National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, Naturopath Jonathan Beatty, health expert here at Nationalnutrition.ca. One of the conditions I encounter a lot in my office because I do a lot of work with autoimmune conditions is something called lupus. Now there's 2 types of lupus out there. It's what we call discoid lupus erythematosus and systemic lupus erythematosus. Both of these are autoimmune conditions. Both of them have the same sort of pathology behind them. The major difference is that discoid lupus typically only affects the skin, whereas the name suggests systemic lupus affects the entire body. What lupus is it's an autoimmune condition, so your own immune system is attacking part of yourself, and it typically causes a variety of symptoms. Now, in the discoid version, it typically causes rashes. Sometimes you can develop small yellow bumps on the skin, and that's about the extent of discoid lupus. However, in the systemic version, you get typically what we call polyarthritis or multiple joint pains. You can get rashes. You can actually have involvement of the eyes. You can get involvement of a number of different organs. And there's a classic, what we call the butterfly lesion or Malar rash, which is a rash that forms on the face. Sometimes looks very similar to acne rosacea, but it's a very specific rash that we see in systemic lupus. And one of the other things that's interesting about systemic lupus is you often get what we call photosensitivity. So people that are very sensitive to sunlight, often triggering a variety of reactions, either increased joint pain, they're easy to get sunburns, they're easy to get rashes when exposed to the sun. And that's something that's rather unique about lupus that you don't see in many other conditions. So, and in some cases, the photosensitivity can actually be the onset symptom. So if you do notice a sudden change in your sensitivity to the sun, go to your doctor and ask them to test you for lupus. Lupus is typically diagnosed by simple blood tests. What we look for are 2 blood findings, antibodies against your double-stranded DNA. So basically what you're looking for is, and this is what lupus is it's your immune system attacking DNA and attacking the nuclei of cells. So the other thing we look for is something called an antinuclear antibody. And essentially your immune system is trying to attack your DNA. It's trying to attack the nuclei of your cells. And that leads to, of course, a variety of systemic health problems when it is the systemic form of this condition. Now, as if you've watched me on any of my other videos about autoimmune conditions, I'm all about diet for this. One of the big things I really promote is what's called AIP or Autoimmune Paleo as a dietary intervention. I find it very effective with a lot of my patients who suffer from autoimmune conditions. Now, it is not the magic bullet. There are some people for whom this diet may cause no changes in their symptoms. That being said, I would say easily the majority of my patients find at least some benefit from the diet, and a few even get complete cure of all their symptoms as long as they're following this diet strictly. So a brief summary of the diet, although I do recommend before doing it, research it a ton more because it is a rather difficult diet to follow, but it's very effective. So it's going grain-free. So this is taking gluten-free to the extreme, 100% grain-free, 100% dairy-free, 100% free of any legumes, so that's your beans, your lentils, foods like that, as well as in many cases also limiting the nightshade vegetables, tomatoes, potatoes, peppers, eggplant, limiting eggs, and in some severe cases also limiting nuts and seeds. You might be asking, is there any food left? Yes, you can still consume lots of vegetables, fruits, and then lean meats and other animal products. And with time, you learn how to make these things very tasty. You learn how to expand your palate, eat a variety of different foods, and still have a positive relationship with food, fueling your body to help you heal from these conditions. Now, in addition to diet, there's a variety of other things that you can do if you have lupus. There's a lot of inflammation that comes with lupus. So I typically recommend a variety of anti-inflammatory herbs and enzymes. So on the enzyme side, I typically recommend bromelain and serratiopeptidase. Both of these enzymes are very potent anti-inflammatories. So when they're taken away from food, what they actually do is they go in, they break down the proteins that cause inflammation and reduce the overall swelling and inflammation in your joints, in your skin, and can be very helpful long-term for the inflammation associated with lupus. I also recommend anti-inflammatory herbs. Now, typically, I'm looking at herbs like Harpagophytum procumbens, also known as devil's claw. I use a lot of Curcuma longa, which is turmeric, and I also use Boswellia serrata. And the reason is these three herbs don't fall in the classification of the foods you need to avoid on the AIP or autoimmune paleo diet. And they're also very potent anti-inflammatories that have good research behind them for managing joint inflammations, which is one of the major symptoms that many people with lupus suffer from. So I find it very good for managing their symptoms and giving them some symptom relief and managing the overall inflammation in the body. So if you suffer from lupus, I hope this video helps. If not, if you know anyone that does suffer from lupus, please share this video with them and subscribe to our YouTube channel. And if you have any questions or comments, post them below. And always remember, knowledge is health.